which is actually a precision machine that provides digital marking during cataract surgery. Now, aside from this, we also provide retinal services, and this includes the management of retinal detachment, age-related macular degeneration, and diabetic eye disease. We acquired the first in Malaysia sweat source OCT angiogram, and this actually allows us to take high-definition images of the retina and better manage these diseases. We also want to make sure that we are always accessible to all our patients, and they can make appointments to see us with a click of a button via our online appointment system.
At LEC Eye Centre, we have our in-house optometrists who are vision care experts responsible for accurate testing of spectacle power, as well as contact lens fitting. They also provide vital support to our LASIK services. At LEC Eye Centre, we acquired the first in Asia wave-like refractive suite in 2011. One of the fastest lasers in the market, this unique all-in-one suite connects the machines used to measure the eyes before surgery with the laser machines, so all treatment information is sent wirelessly and allows surgery to proceed seamlessly and with unparalleled precision.
At LEC Eye Centre, we recognize the increasing problems of nearsightedness or myopia amongst children nowadays, and we have in place a myopia control program to combat this. This program involves the use of myopin and eye drop, which has been found to be effective in slowing down the progression of myopia in children. So this program aims to increase awareness about myopia and allows our team of doctors, optometrists, and nurses to work closely with parents to manage this epidemic, which is sweeping the world. A key component of this program.
Quite a number of attendees from our Zoom session. So good evening to everyone, and we still have we're having Dr. Lim and Dr. Umi coming in as well. So tonight our speaker is Dr. Lee. Can I have my team to share Dr. Lee's profile? So I will do a brief introduction. So while waiting for my team to share Dr. Lee's profile. So for those attendees who are during the presentation, I would appreciate that you mute yourself first. Then during the Q&A session, if you want to ask question directly with Dr. Lee, for those attendees in the Zoom session, you can unmute and ask question. So during the presentation, I would appreciate all of you would mute your mic, okay? So a brief introduction of Dr. Lee Man Wai. He's actually a comprehensive ophthalmologist and also a vitreoretinal surgeon. And he's also our medical director in our LEC Eye Centre. So Dr. Lee actually graduated from University of Manchester in UK, and he also had his ophthalmic training in Singapore National Eye Centre, and his retinal fellowship in Lions Eye Institute in Western Australia. At the moment, Dr. Lee is also a visiting consultant in Perak Community Specialist Hospital, as well as a KPJ Ipoh Specialist Hospital. For LEC Eye Centre, we do also have a satellite clinic in Setiawan, where all our doctors are resident doctors. Hi. That's why I say, please mute your mic if you're not speaking. Thank you very much. So without much further ado, I'd like to hand over to Dr. Lee to take over. Can you stop sharing, please? Thank you.
Hello, good evening. Thank you, Anna. And welcome to all of you here in Zoom, as well as to the attendees on Facebook and YouTube. And this is another edition of our webinar series, which we're having monthly, and it's been going on since the pandemic began. We all become very used to it now, and I think I think when everything is hopefully back to normal, if it's such a thing as normal anymore, we'll probably continue with all this as well, because I think it's been a good way to have some interaction with the public, and then usually we get some nice discussion and questions as well. So today, as you may already know, or if you have actually watched some of our live sessions leading up today over the last few days, we've been talking a little bit about cataract surgery and vision correction. and the impact of cataract and how actually surgery itself as a treatment for cataract can help improve the lives of people that suffer from it. So I'm going to start sharing my screen, and I will talk probably the next up to half an hour or so, and subsequently, if there are questions, we shall be happy to answer them afterwards. So let me start there. Okay, so I think Anna already nicely introduced myself. Thank you very much. So I'm the medical director now at LEC, and the long word ophthalmologist here just means I'm an eye surgeon, an eye doctor, and I also have a special interest in the retina. The retina is the nerve layer of your eye, so I spent some extra time specializing in that area. But today we're not going to be talking about that. We're going to talk about cataract, which is very common. So cataract and its impact on our lives, I think it's one of those things that if those that know about it will feel it's something inevitable, I think we will all get it as we age. But actually, what is cataract? So let's go back a little bit just to run through very basic anatomy to look at, of course, our eye you will see here. And just let me put a little laser pointer, and maybe you'll see that better. This is our eye, if you look at it from the front. So I always talk about the black part of the eye, which is the pupil. Actually, sitting behind the pupil is where the lens is. So if you look at a cross-section, or if you look at a side view of the actual lens, and this is how the lens looks like and where it sits. And it's essentially this lens that actually degenerates with age, and that's what forms a cataract.
In the healthy eye, the lens is clear and allows light rays to pass through unobstructed. As a cataract forms, the lens gradually becomes cloudy. As light passes through this cloudy lens, it is no longer clearly focused on the retina, causing images to appear hazy or blurred.
So if you look at the eye itself, like an optical system, a bit like a camera, so the front part of the eye is like the focusing part of it. So the light comes through the front of the eye, focused by the lens, and everything, as you see in this image here, gets focused onto a point on the retina, the nerve layer of the eye. And that's how we see. So from that image is then transmitted to the brain, and the whole pathway is actually a complex one that determines how we see. So the cataract or the lens only plays one part, but a very important part, of course. So what happens in the case of a cataract, as you will see, the image is no longer in focus because the lens itself is not clear anymore. And that happens usually because of aging. So what are the causes? I think the most common cause is age. Usually it's beyond the age of maybe about 60, 70. Most people will be having significant cataract, but cataracts can happen at any age. And in some cases, we have people born with cataracts, and it's not uncommon now. I do see people in their 40s or 50s that want their cataract done for different reasons, which I'll go into later. So other medical problems can make cataracts progress quicker or come on earlier, such as diabetes is one of them. If you have an injury to the eye, such as maybe you accidentally got hit in the eye by maybe a tennis ball or something when you're cutting the grass, or you get poked in the eye, it may not give you a cataract straight away, but it can make the cataract develop quicker than your other eye. So it might be faster and cause blurring in that vision earlier, or in that eye earlier. Some medications cause cataract. Steroids is the main one that is the culprit. And what I mean by steroids, Chinese call it 类固醇. It can be in any form. So I have had patients which have skin problems, and they're using skin steroid cream to manage their skin condition for years, and they can develop cataracts that way because the steroid medication can go throughout the body and can have effect on the lens. You can have steroid eye drops, of course, and even inhalers for asthma. People that use steroids daily because of bad asthma, they can develop cataracts earlier as well. And of course, exposure to the sun is one problem. I think we have a lot of sun here in Malaysia. So remember, when you do go out, wearing some sunglasses does help to protect your eyes as well. So what actually happens when you have a cataract? Very commonly people will talk about blurred vision. Sometimes people will say about glare. It can be hazy or smoky vision. Some even say double vision. So there are many things that can cause blurring, or the cataract can produce symptoms in different ways.
For most people with healthy vision, this is what it looks like around a city street. But the scene looks different for people with cataracts. When you have a cataract, the lens of your eye gets cloudy, and that can make your vision blurry. Do you see how there's a brownish tint to the street scene? Having a cataract is like looking through dusty glass. Over time, cataracts can also make seeing colors harder, especially blue and purple. And people with cataracts may be sensitive to bright lights and see glare. Cataracts are common, especially in older adults. The good news is that eye doctors can treat cataracts with surgery, and you can go home the same day.
So that's an extreme example of, well, not extreme, that's quite an advanced simulation of what cataract could be. I think can look brownish. That's because when the lens gets cloudy or degenerates, essentially what's happening is it turns more and more yellow. And that happens because certain wavelengths of light get cut off, and you end up getting, like just now as the narrator mentioned, certain spectrum of light you tend to see poorer. So what does it mean actually? Now, when you have cataract, of course, your vision gets blurred. I think a lot of the time we think about, getting losing vision as to because you're getting older. Some older people will just accept it and say, okay, I'm getting older, and therefore just adapt accordingly. But essentially, it has a lot of impact on our lives, because what happens is we lose quality of life, things that we're used to doing. If you've been usually very independent, going out on your own, driving, buying your own food. I think now, of course, because of lockdown, it's very difficult for us to go out. But if you understand what I'm saying, the things that you're used to doing, you're not able to do anymore. Just as much as now we are forced to be stuck at home, so our quality of life is limited. I mean, what can we do in the house? We can't go out very much because of the COVID. But similarly, when you lose vision, if you imagine that you're already locked in, because you can't go out, and now you to have poor vision as well, what are you going to do in your house? It's really not much quality of life. Now, because of medical advancements as well, I can safely say that globally, especially in a fairly developed nation like Malaysia, I think the actual lifespan is actually improving as well for most people. And subsequently, people are working more and more and longer. So it's not uncommon for people to work beyond the age of 65, the so-called retirement age, into their 70s even. And if you have cataract and you can't see well and you can't work, so of course that will have an impact in terms of your loss of earnings. Social engagement, I think as humans, we are social creatures. And what have we been taught over the past 18 months is that we are suffering because we're not able to socially engage with our fellow humans like before. We can't go out, we can't talk, we got to wear masks, we got to social distance. So if you lose vision as well, you can imagine that you can't see well enough, and you will lose that engagement that you normally have with your friends. You may not be able to go out as much because you can't enjoy it as much because you can't see well. And of course, what happens then is that will all have some impact on our overall mental health. I think mental health always have a bit of stigma. People talk about, don't want to talk about any issues about depression or any issues about related to mental health well-being. And really, if you have visual loss, I think it is not uncommon. I've seen many of my patients that end up being quite depressed as well. So some of the impacts could be this.
You remember the beginning, and you want to see the rest. You don't just want to be there. You want to experience what there is to experience. See what there is to see. But as you enter your 60s, cataracts can make that harder than it should be. Taking care of the problem before it gets worse is the best path for your eye health. Your family matters. That's why your sight matters too.
I think that is just an example. Like I say, I know of course it's not in the same context of the local population, but essentially what that video was just trying to illustrate is the fact that as we age, it does affect our relationships as well, because we look at our family and we watch for example grandchildren growing up, and you lose the enjoyment there if you can't see well and enjoy those special moments with them. So those are some of the impacts that, not many people will talk about. People will say, yeah, I can't see well, but what actually does that mean? So there's a lot of implications because our sense of sight is so important. But fortunately, cataract is very treatable. And really, we should not have any, in this day and age anyway, I think most people should have access to good care for their cataract because it's very accessible, especially in Malaysia. I think we are not in a real third world where it's difficult to access treatment for cataracts. And early cataracts can be treated with something simple as glasses. You find that there's a change in your power. It's not always, as those videos have shown, that your vision goes brown and hazy straight away. It's very gradual. So a lot of my patients will come in and say that, the last 6 months I've changed my glasses 2 times, and now it feels like my vision is blurring again. Then you need to change glasses. So frequent changes in glasses as you age is one of the things that cataracts can do because it causes a change in the power. And early cataracts can be managed as a simple change in glasses, which can help to delay surgery if surgery is not at the right time. But essentially, the final thing that we need to do is to do cataract surgery because that in itself will cure the problem in the sense we take out the cataract and we have to replace it with the lens. So what is actually cataract surgery?
A cataract is the clouding of the eye's natural lens, a structure which is positioned behind the cornea, iris, and pupil. Like the glass lens of a camera, our lens adjusts to focus our vision. The lens is mostly made up of water and protein. As we age, these proteins change and may begin to clump together, obscuring portions of the lens. To correct this, a doctor may recommend phacoemulsification cataract surgery. Before the procedure, the surgeon numbs the area with anesthesia. Pressure may also be applied to decrease the internal pressure within the eye. This will lower the chances of complications later in the surgery. Then a small incision is made in the cornea of the eye. Fluids are injected into this incision to support the surrounding structures. The top of the lens capsule is then removed to gain access to the cataract. The surgeon then uses ultrasonic waves to fragment and emulsify the clouded portions of the lens. They are then removed. Once the cataract is removed, an intraocular lens, or IOL, will be placed into the empty lens capsule. Small struts will hold it in place. Once properly positioned, the synthetic IOL restores the patient's vision.
Okay, so that is just an animation of how cataract surgery is done and just illustrates the principles of surgery, really. I think just contrary to certain myths that some of my patients have mentioned, they asked me before, do you actually take my eyeball out and put it next to me and then operate on it and put it back in? Obviously, we don't do that because we can't do that. So we put small little wounds in the eye. I will illustrate that with an actual live video afterwards, a short one, to show how those principles as shown just now is carried out. We make a little opening, access the cataract, suck it out, and put in an implant. Now at LEC, this is the primary thing that we do a lot of. I think we do a lot of other things. Our scope of services are wide, but we do cataract surgery a lot. The main thing, that's what we do. So the other things, it's not the topic of discussion today, but the way that we do cataract surgery is also not so straightforward in the sense that the surgery itself may be quite straightforward, but there's a lot of planning required. And if you do have perhaps friends that have had surgery before, or maybe even at our place, you'll find that there are quite a lot of steps and procedures that we go through to ensure, firstly, that surgery is going to be done safely. And secondly, because the lens implant that we put in has to be accurately calculated. And I'll show to you why that's important. So over here are some of the machines that I will show here. There are still a couple of others that I've not shown here, but the key ones, there's a cataract planner that we use to measure your eye. There's this image guided system, which is a digital guided system, which we use during surgery to help us align the lens properly and to put our incisions accurately to enter the eye. And this essentially is the workhorse which creates the energy required to break up the lens and suck it out. So these are just high-tech machines that the eye doctors will use to treat cataract at our place. So what is cataract surgery essentially involve? I think it is no longer like what it used to be. I think 40, 50 years ago when it first started, you need to actually enter the hospital and stay for up to a week to recover from it. But nowadays it's day surgery, and we are a ministry recognized day surgical center whereby we do all our surgery under local anesthesia. In this case for cataract, most of us do it under topical anesthesia, means that we put eye drops to numb the surface of your eye so you won't feel any pain. We'll give you a bit of medication and monitor your heart rate and blood pressure and your breathing during the surgery, which usually can range from 10, 15 minutes to about 20, 25, half an hour. Doesn't take long, but you expect to spend maybe half a day in our place because we prepare you, get you changed, and make sure your eye is clean and prepared. And after surgery, we make sure that you're up and alert and have a little drink so that you're not too dizzy or not too sort of groggy from the sedation that we give. This is a setup that how our surgical room, our operating room will look like. And believe it or not, this is there is a patient underneath all this, what we call draping, or this cloth that's covering, because it maintains the clean environment, the sterility. We operate using a microscope whereby we don't actually see our hands, but we see the instruments within the eye, and we have to magnify everything with this microscope here. And this is me or my colleague, I'm not sure. Well, this is definitely me there operating. It's just another example. And this is just a bit of a close-up view of how the hands are positioned and how we actually do things. Now, this is actually a live video of one of the patients I operated on recently. And this is how, if you saw the animated video, we are opening the lens capsule to gain access to the cataract. And you see this little green thing that's moving around. This is the digital marker I was talking about. So you see those little round dots is what helps us to align this opening centrally so that you can see that the line is actually following the capsule opening that I created is following that line. So that's why it helps to improve our precision. So this machine here is actually delivering high frequency ultrasound. It's not exactly laser, similar in the sense that it's invisible. It actually softens the lens and breaks it up, and you see the cataract is being sucked up after it's been broken into little pieces. This is obviously an edited video. It doesn't happen that quickly, but in my hands, usually about 10, 12 minutes is the length of a surgical time. And most of the bulk of the hard lens is removed now. So we use a different sort of a vacuum cleaner, a sucker kind of a handpiece now to just aspirate the soft lens matter to actually go into the pot and go into the machine. As you see, the eye is still within the eye socket. We're not taking it out, and we're not actually moving around too much. There's no pain being felt. The patient is wide awake. I'm usually talking to the patient to actually make sure that they're okay. This is how a lens looks like. It's got two little legs, which we actually fold. And this system of implantation has, revolutionized how we use small incisions, because you see everything is rolled up and it goes through this little opening, which is about 2.2 millimeters, and the lens opens up. And what happens now, this lens itself is a Vivity lens. Afterwards, I'll tell you a bit more about this specific lens, whereby it's actually aligned according to this marking here at 91 degrees, because that helps to correct astigmatism. And this lens will correct your vision so that it allows you to see far, see intermediate, and see near as well without glasses. So this is, as I'll mention afterwards, what we call the Vivity lens. So I've talked about what is the impact of cataract, and we talked about how we can treat it. So obviously, cataract surgery itself will have all the positive impacts of reversing or eliminating all the negative things that cataract can do. So when you've lost quality of life, you get depressed, you lose confidence, so it helps improve your self-esteem. When you cannot work, now it helps to restore your vision, so you get to improve your productivity. And as I mentioned just now, there is reduction or a loss of social engagement. Now you can go back and do your things and go back and social participation, of course, after lockdown has been lifted, and back again to your interactions with your family members and your friends and your improved relationships as well. So those are very positive impacts on the lives of patients that have had cataract surgery, and that's what actually vision means to us. So when are we supposed to have it? Does it mean that you have a bit of cataract and straight away you do operation? As I mentioned earlier, you can actually have glasses to be changed to allow you to function if you want to have surgery a bit later. But essentially what I tend to tell my patients, there's no real definite set point for everyone. Most common is they ask me, is the cataract ripe? Is it ready to be done? And honestly, nowadays, we don't have that conversation anymore, in the sense that I don't tell my patients that you do have to have your surgery right now. Well, of course I do if they're practically blind and they just cannot see at all and the cataract so thick. That's no argument there. But most of the time, we talk about how their daily activities are affected. So the cataract consultation with the patient will involve understanding their individual needs. So we find out what they do. Are they still working? If they do, what do they work as? Are they driving? That's very important, because driving has to be done safely. And obviously, when you can't see well, safety is not only for yourself, but of course for the other motorists or pedestrians out there on the road. So you have to make sure that they can see well to drive. I think that's a responsible thing to do. And nowadays, TV, of course, is something that's integral to our lives because of lockdown, and reading, of course, books, or it can be iPad or your tabs, or of course, our mobile phones are something that we cannot live with anymore. One thing we don't actually mention too much, but we may forget sometimes, but as we age, unfortunately, aside from having problems with your vision, you can have other medical problems. And classic example is having diabetes or hypertension or cholesterol. And if you're bad enough that your diabetes requires insulin, you have to be able to administer your insulin yourself. And if you're not having anybody to do it for you, you must be able to get the dosing correct. And therefore, your vision is important. Otherwise, you overdose or underdose yourself for medications. And other things would be your enjoyment activities. You play golf or you exercise or swim. Those kind of things has an impact on the kind of the timing of the surgery that you want for yourself. So as I mentioned, we try to talk to the patient, not convince them to have cataract surgery, but tell them what are the options available to them and help them decide. So I'm never for one to actually say to the patient that, you should do because of this, but really it's more so they're saying that this is the impact you're going to have on you. If you don't do it, you might end up not being able to do this, and help the patient decide. So correcting your vision, as I mentioned, with cataract surgery depends a lot on that little implant, that little plastic implant that we put in your eye, which is actually very small. It talks about maybe about 5 to 6 millimeters in diameter. And if you include the haptic length, as you saw just now, we've got funny shape there, like a little reverse S shape. It also amounts to about 11, 12 millimeters at most. So it's actually very, very small. But that implant has a big impact because it all depends on whether you drive more, or you think your phone vision is important, your computer, or you like to read a lot, be able to see things without glasses. And essentially is to think about, do you want to continue wearing glasses after surgery? I think it's fine. A lot of people are happy to wear glasses because they've been wearing all their lives. And there are a lot of people, more and more so now, that do not like glasses because they find them inconvenient. One of the most common complaints I've had over the past months is because everybody have a mask on now. And having that mask with a pair of glasses, you can imagine that it's just a recipe for creating fogging and difficulty with your vision, and having to take your glasses off to unfog it, or take your mask off, which is worse because you might end up exposing yourself unnecessarily. So that's one of the reasons that some of my patients have chosen to have surgery early, because they don't want to wear glasses anymore. So this is just a small sample of the type of lenses that can be available. There are many, if you go and Google, there are so many different implants available. And rest assured that at LEC, we tend to use the high quality lenses that have, in this case, actually been made by a company in America, and it's one of the market leaders for lens making, and they've had millions and millions of lenses having been implanted over the world. So what we tend to do is choose together with or help the patient choose what type of lenses are suitable, and the type of lenses will based on the needs that they have. So this is just a short video to show you what it was like. As you saw just now, I showed you a surgery of how lens implantation is done now. And this is the first implantation that was done by a surgeon, Sir Harold Ridley, in 1949. This was done in UK in St. Thomas's Hospital. As you see, what went in just now was a disc-shaped lens, and this wasn't made of, it was made of some plastic, but you got a big stitch there to actually suture, and you can see that things have come a long way since then. But that essentially is the first implant that's gone into an eye, and that's, 72 years ago. So that's a long time. So the technology has advanced so much now, such that we now have implants which will correct your vision based on your needs. So think of two broad categories, what we call monofocal. Monofocal, as the name suggests, it focuses all the light or all your vision into one focal point, hence mono. And usually we will correct for distance, and that's what most patients require. Distance means that, for example, they can walk around, move around their house, perhaps watch TV, and even drive without glasses. But they will need a pair of reading glasses if they want to pick up their phone to look at their messages or to look at newspapers. So that's what a monofocal implant is. But on the other hand, I have a small group of patients that prefer not to wear glasses to read. So we use a monofocal implant, but we can fix their vision so that they can read without glasses. But then the other way around is they need glasses to be seeing far for TV or to walk around or to drive. So really that depends on, as I mentioned earlier, that what we talk to the patient about what their needs are, and therefore there is no one size fits all. So typically, again, I have patients that say that, oh, my friend had this and doesn't need to wear glasses. Can I have the same thing? So I will never say yes, because what your friend has may not be what you need, because you do not know what your friend's requirements are. So I will always start from scratch and find out what they actually want. Doesn't mean your friends can see without glasses, that's the right thing for you, because there are certain compromises as well. Now, what is a toric implant? A toric implant is just a medical term to talk about this intraocular lens. It's got this little 3 extra dots there. If you see the lens that I put in just now, the live video I showed has got that alignment, little dots as well, because it helps to correct astigmatism. Astigmatism, I think Cantonese call it sang guang. Malay, they call it silao. Essentially, it's just another form of focusing problem that the eye has. So rather than being able to focus things clearly, this eye is of a abnormal shape such that it doesn't focus things sharply in one focal point. And using this toric implant or this intraocular lens that can correct astigmatism, we can correct that. So you actually can see well, have less dependence on glasses. And finally, this presbyopic implant. I think presbyopia is a big term. I think usually it just refers to a reading problem, or Cantonese called lo fa or la hua, or basically just means that as you age, you find that reading becomes a bit of a problem, and you have to move things further and further away. And even for those people who are short-sighted, who are used to reading without glasses, at some point this will kick in, and you'll find that you're not being able to see so well as without your glasses as well. So the implants that we use nowadays, you can call them multifocal, but multifocal is not really a term we use so much now, because technology has changed now that people talk about trifocal, or they talk about extended vision kind of lenses, intraocular lenses, or extended vision kind of implants. So this will correct everything. So these are for those individuals that say that, I'm active, I don't like to wear glasses, or will prefer that, 90% of the time I don't need glasses. If I need really fine print, I don't mind putting a pair of readers, but I would like to be able to do most things without glasses. This is the type of implant then I would use. So the Vivity, as you heard, is something that I'm just going to elaborate a little bit about. The reason being is because it's the latest addition of lenses to our range of lenses that we've taken on. And it's actually been around the world for quite a few years now. And it's come into Asia only recently, and to Malaysia as recent as probably 2 months ago. And at LEC, we are fortunate to be able to be the first to use it in Perak. And I've put in quite a few now and got some good results. And essentially it's for those individuals who want to have less dependence on glasses. So we can give you good distance vision, intermediate vision, and what we call functional near vision means that you can usually, like in this picture here, read your menu, and you can read your newspaper, usually look at your phone. But if you'd like to look at small prints and read perhaps, the medicine labels and all that, you might still need a pair of reading glasses, but it's very functional. So majority of the time, you don't need glasses. And one of the advantages of this lens is that it's designed in such a way it does not split light, so you don't get so much of the glare that can happen if you use the more traditional type of what we call multifocal lenses, where it gives you the same distance, intermediate and near, but it splits light so you can get more glare, and that can become a problem when you drive at night. Just for example, in this image down here, it can give you that little bit of a halo and the glare. So this has been a lens that's been using a bit more recently, and I think it's something that has a good role to play for those who require the independence from glasses. So I'm coming towards the end now. Just want to share a few testimonial videos. I think I don't have local patients' testimonial at the moment because, like I said, the lens has only just come into Asia and to Malaysia. So there are some videos that are a few little snippets of testimonials from patients that have started with this lens a few years back, and this is in US, in Canada, in Europe, and in Australia.
My vision is excellent, even in areas where I had to wear glasses before. I never thought my vision would be so good at age 81.
It was unbelievable. I could see everything from distance to up close with no issues. I have no difficulty driving at night anymore.
Before the surgery, I had to use bright lights. After the surgery, I could see things clearly in low light. It made a great change in life. It's a great feeling. Oh my God, if you use glasses and then if someone says, you don't have to use anymore, that's a great thing.
They've changed my life. I was just absolutely astounded. I can see everything. I can do anything I want to do.
I would rate it 10 out of 10. In all conditions, whether it be night or day. Everything's so much clearer. Even when you're surfing, you can see little fish swimming around. It's just amazing. That's something you couldn't believe could happen to you at my age. It's just life-changing.
Okay, so as I mentioned earlier, how do you choose? So choosing is really about understanding what your own requirements are. So firstly, you're going to ask and understand yourself what kind of activities are important to you. And next thing is to decide, do you mind wearing glasses doing those activities? If you say, like in that video, you see that somebody who drives a lot, or that person who's still working and making violins and woodwork, those are the kind of things that you need to think about. Because if you find that doing those things and with glasses, it becomes cumbersome, then you have to think about using the kind of implants to actually suit those needs. Then what you need to do is to ask questions. So don't be afraid to talk to your doctor, ask questions, and make a decision that is hopefully the correct one for yourself. We don't want to actually have a mismatch of expectations. That's the worst thing, because doing the surgery is one thing, but not being able to achieve what we set out to achieve together is obviously going to be a disappointment. So how do we avoid that? Is to first understand each other. So important to speak to your doctor before you have cataract surgery. So just a few final words. So cataract actually can cause blindness, but it's rare now for me to see people that are blinded from cataract. And even if they are, and there's no other eye problems, we can do surgery and we can actually cure their blindness, so to speak. So it can be treated very successfully. So don't delay surgery to the extent where you suffer. It doesn't mean that you just operate anytime and, being trigger happy about things. We're not like that, but make sure that it's a time where, we can do things safely because it's fast and it's painless. So remember that you need to discuss the options that you have with your surgeon and understand them before you commit to surgery. So some of the changes we've had over the past 18 months, really, if you're actually looking to try and come to see us, is basically Making your appointments are easier now. You can just call, you can go to our website, you can go to our Facebook page, Instagram, YouTube. And we also have an app over here called the AnchorMed. It's an appointment app system that we have actually been using for a few years now. And more so now, you can download it in a Google Play Store and App Store. Essentially, if you find us, LEC Eye Centre there, you can choose whichever surgeon you want to see on a particular date, and you can see what are the appointment slots and book them yourself. So that's one way to do it. Now, there are also certain issues where we've had, particularly with MCO period, where we had patients, not so much for cataract surgery, but for other eye conditions like glaucoma, where they need regular eye drops, dry eyes and things like that. So we do a medication delivery service as well. And we also go as far as to do an online consultation. If patients have certain questions they have to ask, for example, if you do have certain things about your consultation about cataract, you go back, think about it, and you have questions, you can WhatsApp or call us and say you want to have a consultation with a doctor. We can arrange a slot so we can do a WhatsApp video call. It can be simple as that, and do that online if you don't want to come in. So thank you very, very much for your time. I think, as I mentioned, I take about half an hour or so. So now we've got the remaining time to actually answer more questions, and hopefully we can have a fruitful discussion.
Thank you, Dr. Lee.
I'm going to
share.
Sorry, let me stop the share. For some reason, I can't get rid of my pointer.
Continue with your sharing some more.
Anyway, you start. Anybody got questions? Go ahead first. I will just try to stop the sharing because I'm trying to get rid of the pointer.
I think, probably it's your pointer that is affected.
Yeah, let me.
There is a question from our Facebook asking any pantang after cataract surgery. So I think the pantang part probably I will just add in a bit more. Maybe in terms of food as well as maybe like anything they should do and the do's and the don'ts.
Yeah, I think pantang is a very cultural thing. And I'll be honest with you, in Malaysia, we're multicultural, be it whether you're Chinese, Malay, or Indian. You can pantang a lot of things. Different cultures believe different things. But as you know, I'm Western trained in terms of medicine. So I cannot have any evidence to say that you cannot eat chilies, you cannot eat spicy things, you cannot bend over and tie a shoelace because your lens will fall out. There's no evidence to actually prove any of those things. So if you ask me, if I speak strictly as a Western trained doctor, I say nothing to pantang, you do what you want. But being also part of this culture and Chinese myself, I can say that, just follow your own cultural beliefs to a moderate degree. So I think you want to avoid certain foods, go ahead. But you don't have to do it for too long. I would say probably a couple of weeks may be good enough. Otherwise, you'll be suffering with dietary restrictions that, you become miserable. I had one patient that went so far and strict with herself that after I saw her, after about 6 weeks, she had lost weight and she was miserable. She can see very well, but she was depressed because she's so restricted. So I think that's the wrong way to do it. It's not so severe. Yeah.
I remember one patient's daughter also shared, the father refused to tilt the head down to eat.
Yeah.
So every meal time after surgery, put everywhere on the table because he's eating straight like that.
Okay.
Okay. Thanks, Dr. Lee, for the answer. Any question from the attendees in the Zoom session? If you'd like to ask the question directly, you can actually unmute yourself and then you can ask the question.
Dr. Lee.
Yes.
Hi, Puru. Hi, Puru. How are you? Wow, long time no see.
This one, my cataract operation has been done more than 5 years ago. So, but the problem is the floaters appear at certain period of time. So how I need to consult you again. So floaters really is bothering me when I do reading and all that.
Yeah, the floaters are unrelated, to be honest. Usually floaters are, there's a gel substance inside the eye, the cavity of the eye called the vitreous. So this gel actually tends to break up into little pieces as we age because parts of it turns to fluid and some of it is still solid. So what you see as floaters essentially is, when the light comes in, those little things that are floating will block the light and then you see them as shadows. Yeah, it's not usually dangerous, but if they are suddenly increasing in number, or if suddenly it affects the vision in a very bad way, of course we have to see you. But if your vision is affected, I think it's no harm.
But
you're
seeing
okay.
far, no problem.
No problem.
I think it is no problem.
It's the reading.
The reading part.
Yeah, because the floaters is blocking.
Yeah, floaters.
I never see you for a long time, so you should come in when you're free.
I should come in. I'll make an appointment through your app. Then I'll come in to see you.
When
because now it's MCO.
Yeah.
No inter-district level. With the appointment only can go.
You're in Kampa, isn't it?
Yeah, Kampa.
Yeah. Good. But Kampa is quite good, isn't it? In terms of, all this while. Everything.
We had a cluster in Kampong.
Oh, okay.
But in Kampong Jelutong on the way to Maliminawa.
I see.
So about 40 people there, but still under control here.
Good.
Okay. I just will ask you this question only. Nice meeting you, Dr. Lee. So long. Look like you put on some weight already.
I've actually lost some weight.
Put on weight, look like.
Really? Yeah. I think you have to get your eyes. I go and check your eyes. You better check properly.
Yeah. Okay. That's the question. Thank you.
Dr. Lee, I think also there's a lot of patient has been asking us in the center or when they call, between like the first vaccination and the second vaccination, or before vaccination or after vaccination, can they actually proceed for cataract surgery?
Yeah, I think that's a good question, actually, because now that, everybody is pushing to have vaccinations, I think firstly, let's put it this way. Vaccinations are the way forward. It's important. I think we want to put that message through, that those of you who are not registered, please go and do that, because that's the only way we can hope to protect ourselves or protect everyone. Now, there is no proof or evidence. I think I'm always talking about evidence because, that's how we practice our medicine. We have to look at what people have done and see how we can guide our practice. So at the moment, there's no evidence or proof to say that the vaccination has any direct impact for you when you're going for cataract surgery or things like that. I think you will read a lot about either be it viral WhatsApp news or, either in the newspapers, or you can read enough in the Google about the vaccines maybe having problems causing inflammation or can causing blood clots and things like that. So for cataract surgery, no direct impact. Having said that, you'll also be mindful of the individual patient, because if that patient is more elderly, has got other conditions, maybe diabetes, high blood, not feeling so well, or has some concerns, cataract surgery is not so urgent in the majority of cases. So it can be deferred. So I have patients that say, they have booked their surgery to say that it's next week. And then the My Sejahtera comes 2 days ago and say, I got vaccination. And then they say, I cannot go for surgery. Is that okay? I say, fine. Have your vaccination. In fact, if you feel more comfortable, have your second dose after 3 weeks. Then do your cataract surgery. It's fine. It's not urgent. But if you ask me, I said, if they say that they don't want to delay because everything's been arranged and, family members are free on those days to bring them in, I think go ahead, no issue. You just still have to look out for the signs and symptoms of vaccination, like you need paracetamol if you're not feeling so well and things like that. But it won't have a direct impact on the surgery itself.
Okay.
I think there's a question about in the chat.
Yeah, in the chat as well. We will switch between, because there's also a question in the Facebook. So we'll take one from the Facebook and one from the Zoom.
Sure.
Okay, Dr. Lee, there's one in the Facebook. How long is the recovery period after cataract surgery?
Okay. Now, when you talk about recovery period, there's two aspects. One is visual recovery. One is actually the physical recovery of the wound and everything, the inflammation is all settled. So you talk about vision, usually pretty quick. So I'm not going to go as far to say next day or straight away you walk out, you can see very well. No. But usually within 3 days to a week, your vision will have picked up quite a fair bit. I won't say it's 100%, that is the final outcome. But sometimes 80 to 90%, your vision can be quite good already after those few days. Now, of course, if you have a very thick cataract, very dense cataract, which some of my patients do, what happens is it'll take a longer time to do them, because the harder, the thicker the cataract, the longer it will take to break it up and suck it up. I think that's just logical. If you have something very hard, it'll take more energy to break it up. And that just means there's going to be a longer time for recovery. So in those eyes, it might be a few weeks or maybe even up to a month. But by and large, most of my patients, usually by about a week, they can see quite well. You talk about total recovery, whereby you don't need any more eye drops. You can go and make glasses, go back to your normal activities. I would usually say about a month. So 1 month is a safe time, after which you can go and make glasses if you do need to make glasses, and you can go back to pretty much most of your activities. So having said that, I just want to make sure that people understand, don't mean that you lock yourself in the house for 1 month and do nothing. Most of my patients are already quite active after about a week. So I hope that answers the question.
Yeah. Okay. Thank you, Dr. Lee. So we will go to the Zoom question. It's actually in Mandarin. So asking like how much is the presbyopic implant, and if let's say if there's no admission for the procedure, if there's no admission in the hospital, and how to claim insurance. So probably this one I can help Dr. Lee to answer.
Go ahead. I think the costs, you go ahead.
Okay, so for Jasmine, to answer your question, for the presbyopic implant, it will range about 7,000 plus, depending on what range of the implants that you choose, or what is suitable for you after you have a detailed discussion with the surgeon. And then depending on your medical insurance from which company, as we are a panel for AIA and Great Eastern. So for that, you can actually do a cashless facility. If for others, if your medical insurance required admission, a hospital admission, Dr. Lee, any of our doctors also can do the surgical procedure admission in para-community specialist hospital as well. Or otherwise, you can do a pay and file process, which means you pay and then you do a reimbursement. So most of the medical insurance company, they actually recognize our pay and file, our invoices. So far, there's not much problem on that. Yeah.
Okay.
Thank you, Dr. Lee. Okay, we go to the Facebook from Zalina Yusof. He say, hi, Dr. Lee. It's in bahasa. Berapa lama yang lens tu boleh bertahan dalam mata? That means how long can the implant would last in your eyes?
Yeah. So the implant is actually, if you look at I just digress a bit. You saw that first implant that went in 1949 is made of a plastic called PMMA. Okay, that's just a biochemical structure. But how that individual, that doctor, discovered it was because he was actually a doctor that worked with pilots during the Second World War. So he was seeing a lot of pilots that came in after injuries with bits of plastic inside their eye because, when they got shot at, and the canopy of the plane was made of this plastic. And he found that inside the eye, the plastic is very quiet. The eye has no inflammation. They don't even have to take it out because it wasn't actually causing a problem. So he had a brilliant idea, because he was an eye doctor, of making this kind of lens from that plastic. And I'm happy to say, I think Dato is on here as well, right?
Yeah.
He's been in the game longer than I have. Those lenses that he put in the 80s until now for those patients, they're still there and not causing any problems. So in the same line, I can say that these lenses boleh tahan lama lah. Sampai we are not here, we are underground already, will still be there. So you'll be fine. Okay.
Okay. So hope answer Zalina Yusuf's question. Okay, so we move back to our Zoom. From Romero, what is the difference between the new VVT and the trifocal IOLs?
Okay, good question. So trifocal, as I said earlier, is now we're talking about lens designs now, because these lenses, particularly when you go to these presbyopic implants, or for those implants where people don't want to wear glasses, again, there are many designs. The traditional designs are multifocal, and the trifocal is newer, and the VVT is the newest. So the trifocal lens itself is designed in such a way that it splits light. So the lens, if you take it up and you look at it under a microscope, it will have rings on it. So the central, usually 5 millimeters, will have rings. So each ring is cut in such a specific manner that it will split the light to allow all of us that have it inside to see distance, to see intermediate, and to see near. So the light is spread out now. That's why, as I mentioned, if you heard what I say, it's a compromise, because if it's a normal lens that has got no rings, that's what we call monofocal, all the light is focused onto one point. So now, if you have a trifocal, by definition, the light is split into 3 points. So what happens, you're going to have distance, you're going to have intermediate and near. But the brain doesn't get confused, because if you look far, the brain knows that you're looking at distance. It gives you the sharpest image from distance for you to see. So the trifocal lens, I still use them because they still work very well. And they can give you actually better reading without glasses than the Vivity. So the Vivity design is different now. So it's the same company that makes trifocal as well as the Vivity, the Alcon that just now is an American company. And they've come up with, their secret design that they won't actually explain to you in detail. But essentially, it doesn't split light anymore. So it uses the full column of light, but it extends the actual wave front, so to speak, because light is not just a single point, it's made of different wave fronts, and it helps to focus at different intervals within that column of the wave front that's been extended. So the advantage there is you don't have the light splitting, so you won't have all the side effects of glare and halos like the trifocals do. But the disadvantage is the reading part is not as good as the trifocal. That's why I still use the trifocals as well, depending on the patient.
Okay. I hope, Romero, if you have any more question to ask, if not, then we will move on to the next question from Candice. Doctor, patient have had eye laser before and have hypertension fit for this cataract surgery. I think the eye laser is LASIK. I believe it's LASIK, right?
Yeah. I think we are seeing quite a few patients that have had LASIK before, because again, LASIK has been around for 30 plus years. So it's not uncommon that those that had LASIK earlier now come to the age where they have cataract. So in fact, I just did one patient that was like that yesterday. So what happens now is you can have cataract surgery, because you need to have cataract surgery, because otherwise your cataract will slowly make you not able to see. But the difference is now that once you've had laser before, so that has changed the structure of your cornea or your eye somehow. So we have to calculate differently as to measure the correct power of the lens to put in. So we have different ways of doing that, and that is with the cataract planner machine that we use and different formulas that we use. So the accuracy is not as good as what we call the normal standard virgin eye. Virgin eye means that never been touched before, never been lasered, but it's still good enough that in 9 out of 10 times we can still get a very accurate reading on eyes that have had LASIK. So hypertension, I think you can throw a stone outside into this group of 34 people that's attending in Zoom, and you probably half of us might have hypertension already, because it's so common. So if you have hypertension and you cannot have cataract surgery, then a lot of people cannot have it. But hypertension needs to be controlled. You cannot have your hypertension too high so that your BP, because you go for surgery, some of my patients get nervous, the blood pressure goes high, it's not good. So as a safety, we all do ECG, we do a heart tracing, we check your blood sugar, and we check for your blood pressure before you have surgery, and monitor during your surgery as well. So at any point where we are concerned, we either give more medication or we cancel the surgery. As I said, cataract surgery can always wait until you are fit to actually have it.
Okay. Before we take the next question, I would like to share with all our attendees, whether it's from Zoom or our Facebook, our next live webinar would be with Dr. Lim Eng Hock. All right. So Dr. Lim would share about I hate glasses, which I think a lot of people would like to get rid their glasses, to be glasses free. That will be on the 19th of August. Same time at 8:30 p.m., which is also on a Thursday. So we will share more and more details in our Facebook. So if you want to know more and get updated, remember to like our Facebook page. And then next, for all the attendees in our Zoom session as well as our Facebook session, we are posting a link for you to register for your free eye screening and as well as a full consultation with our doctors, with Dr. Lee, Dr. Umi, or Dr. Lim, but it's only by appointment. So you click in the link to register, Don't worry, you don't have to do it now. You can get the link from our Facebook page. The link will be open and valid until tomorrow 5 p.m. Okay, so you can register and then we will call you to make an appointment for you. All right, so we will go to the next question from Daniel Ha. Mind to share a bit the more advantage having cataract done now rather than later. So this will be the last question we're going to take from the house.
Okay, I think that is a very valid question because it depends on the individual needs. So like I mentioned earlier, that most of my talk was talking about trying to suit the needs of the patient. So it all comes down to whether that patient is affected by the cataracts now. So the mindset of a lot of my patients are one of two mindsets. One is don't fix what is not broken. I got one group of patients that's like that. So if they're managing well, they're happy with their glasses, they're doing things okay, their cataract is not so severe that they cannot see, then I say, wait, no, because they feel that they're okay with their current situation. There's another mindset of my cataract patients that will say that I'm going to have to do cataract anyway at some point because when I live long enough, the cataract will get bad and affect my life, isn't it? So why I want to wait? I might as well do it now, put in a lens so I can enjoy good vision and enjoy good vision for the rest of my life. That's another way to look at it. And they also feel that if I do it now, then later on, touch wood, as I get older and I get more frail, I've got other medical problems. So I want to have cataract surgery, also cannot. Then really at that time, the quality of life is poor because you're not well and you cannot see. So I tend to veer a little bit more towards the second mindset, whereby do it at a time where you're still relatively fit and not so frail, or touch wood if you do get frail and not able to manage it now. So what is the actual sweet spot? I think over my years of experience, usually is around about 60s, maybe to early 70s. That's around the time that most of my patients will have their cataract surgery. But again, I always look at the individual patient. So it's not one size fits all. So I will always have the same conversation with all the patients before we decide. Yeah.
Thank you, Dr. Lee. I think it answered partially of one of our questions from Facebook, because was asking what would be the recommended age for cataract surgery. And then her next question is it safe to have a cataract surgery on her grandma, which is a 90-year-old plus in age?
That comes down to how fit is this 90-year-old plus. That's all I'm saying. I mean, the oldest patient I've operated on is 102. So why? Because the family and herself felt that she can't see well enough to do her things and walk around and eat and stuff like that. So we do it, but you must look at the actual the risk and benefits. So I've also had patients that are in their 20s who have cataract that are significant. So does that mean that I have to wait until they're 60? Of course not. So again, that question can be answered one way or the other. So there's no set specific age. But like I mentioned, on average, based on my experience with the different patients over the years, it's around about mid-60s to early 70s. That's the average age. Yeah.
All right. Thank you, Dr. Lee. Thank you, everyone, for joining us and spending your precious evening to learn more about the cataract and how it actually impacts your life. If anyone, you still have questions, you can post it in our Facebook page, and then we will attend and respond accordingly, okay? So thank you, Dr. Lee. Thank you. Dr. Umi and Dr. Lee Mandato for joining us as well. Our resident consultant, other resident consultants also are in the Zoom session. So thank you, everyone. Thank you all the attendees in our Facebook live session as well. So join us and remember to like our Facebook page as well to have more updates and about our next live webinars and about eye care tips as well. Thank you, Dr. Lee.
Thank you. Good evening, everyone. Stay safe and get vaccinated. Okay?
Yeah.
Thank you, Dr. Lee. Thank you.
Okay.
Thank you, Candice. Good night.
Good night.